Yeah, there is an ongoing debate whether the known atrial fibrillation or AF detected after stroke are different entities. I think it really depends on what you're actually looking at, and I think for me, it's the question of the burden is more important. So obviously, it differs if your atrial fibrillation that you call atrial fibrillation is like detected on a 12-channel ECG on admission or during stroke unit or on a, let's say, 72-hour ECG monitoring. I think that's an atrial fibrillation that is for certain indication for anticoagulation in the ischemic stroke patient, and probably reflects a higher burden because you picked it up in a short recording time frame. Whereas if you have somebody, you go for an implantable loop recorder, and after 2 years after stroke, you have 2 minutes of AF, then I would be much more careful, really, to call this atrial fibrillation. I mean, it is atrial fibrillation on implantable loop recorders, but whether it merits anticoagulation is a whole another debate. And I think the question of the burden is more important as the comparison whether the AF was known before stroke or after stroke.